Hello, lovely people. Welcome to Mental Health Matters, a platform whereby we discuss mental health issues. Today's video will be a psychology lecture whereby I will be discussing anxiety disorders. Please don't forget to like this video, subscribe, and share this video with somebody that might get help from it. Thank you. Let's get to the video. The first question one is going to ask themselves is, what is anxiety? Anxiety disorders differ from a normal feeling of nervousness or even normal feeling of anxiousness, as it involves excessive fear or even excessive anxiety. It is pretty normal to feel anxious. Sometimes everyone experiences a little bit of anxiety and tension from time to time. It is pretty normal, as anxiety can be normal for as long as it's not persistent and also it's not consistent. For example, let's say you are alone at night and you hear footsteps outside. It is pretty normal to feel anxious around that situation, because you're going to ask yourself, I am alone, it's nighttime, and I'm hearing footsteps outside. It is pretty normal to feel anxious around that situation. Anxiety disorders are more than a normal feeling of anxiousness. They are characterized by unrealistic and irrational fears. They involve apprehension about immediate or even possible danger ahead that cause one to have an immediate alarming reaction in response to the danger ahead. They cause one to have a response to I have to control the danger that is ahead. The unrealistic fears are so intense that one will even not be able to manage their daily life or even their daily tasks. They have no control over their lives. And anxiety disorders make people feel anxious most of the time or for brief, more intense period, which may occur for no particular reason. People with anxiety disorders may feel anxious feelings that are so uncomfortable that they avoid their daily routines, their daily activities that might cause these feelings. Some people have occasional anxiety attacks that are so intense that they are left terrified or even immobile. People with anxiety disorders are sometimes aware of their irrational or even excessive nature of their fears. It comes to a point whereby a person is saying, I know my fears, I know what triggers them, but I can't stop them. I can't do anything to stop them. They are so intense. Now that we have looked at this, the definition of anxiety, we're going to move to clinical features of anxiety, which are the symptoms of anxiety disorder. So we're going to look at the physical symptoms and also the psychological symptoms. In terms of the physical symptoms, one is going to feel like they want to vomit. They're going to have intense muscle ache and also intense headache. They're going to have accelerated heart rate, which leads to faster breathing. They're going to feel like they need toilet more frequently, even if it's their mind playing tricks on them into thinking that they need a toilet, even they don't really need it. They're going to experience panic attacks. The psychological symptom is going to feel very, very nervous, feeling that people can see that they're anxious, feeling numb, not being able to concentrate, feeling restless, and their mind being busy with many thoughts at once. Thirdly, let's move to the a type of anxiety disorders that we are going to study today. We are going to study specific phobia. Secondly, social anxiety disorder, which also is known as social phobia. We are going to study panic disorder. We are going to study agoraphobia. We are going to study generalized anxiety disorder and also OCD. These are anxiety disorders that are listed in the DSM-5. Post-traumatic stress disorder is also a type of anxiety disorder, but we'll discuss it in more detail in the next video. All these anxiety disorders differ, but they share some similar clinical features, which include irrational and excessive fear, apprehension and intense feelings, and also having difficulty managing everyday tasks. Firstly, let's look at the first type of anxiety disorder, which is the specific phobia. Phobia in simple terms is fear. Phobia refers to an intense fear that is blown out of proportion to the apparent stimulus or the feared stimulus. It cannot be explained, and most of the time it cannot be reasoned to. It usually leads to an avoidance of the phobic stimulus. Usually when a person is diagnosed with specific phobia, they tend to show strong and even persistent fear that is triggered by the appearance of their phobic situation or even their phobic object. They have this intense fear that is triggered by the presence of this specific object or even this specific situation. When a person with a specific phobia come into an encounter with their phobic stimulus, they tend to show an immediate response of fear that is often accompanied by panic attack. Such individuals who are diagnosed with a specific phobia may experience anxiety attack when they think about coming into an encounter with their phobic situation or even their phobic object. They experience a lot of anxiety attack, even more anxiety attack when they think of coming into an encounter with this specific situation or even this specific object. They go into great lengths of avoiding coming into an encounter with their phobic stimulus. They often even go to an extent of avoiding innocent representation of their phobic stimulus. They may avoid photograph. Someone who fears snakes may even avoid coming into encounter with photographs of snakes or even television images of snakes or even telephone images of snakes. Specific phobia involves marked and even persistent fear of certain and specific object or situation. There are 5 subtypes of a specific phobia, which is the animal type, which is fear of it may include fear of mice, fear of spiders, fear of snake, and there is the natural type, which is fear of storms, fear of heights, and there is even a blood injection injury type, which is fear of seeing blood or even receiving an injection, and there is a situational type, which is fear of public transportation and even elevators, and there is a fear of someone who's fear vomiting or even fears choking. A clinical feature example include one saying we are all going to die, this plane is going to crash, refuse to getting into a plane because they feel like the plane is going to crash. They may avoid air travel at all or even looking at a way to escape because they have this intense fear of air travel. Let's look at the diagnostic criteria of specific phobia. This is going to take time, but we can't avoid this situation because this is how a person is diagnosed with specific phobia. They have to meet all these criteria. Criteria 1, they must have a marked fear of anxiety about specific situation or specific object. Criteria B, the phobic object or situation must always provoke immediate fear of or anxiety. Criteria C, the phobic object or situation is actively avoided or endured with intense fear or anxiety. Criteria D, the fear or anxiety is blown out of proportion to the actual danger imposed by the specific object or situation and to the socio-cultural context. Criteria E, the fear or anxiety or avoidance is persistent, typically lasting for 6 months or more. Criteria F, the fear and anxiety causes clinical significant distress or even impairment in social, occupational, or even important areas of functioning. Criteria G, the disturbance is not better explained by the symptoms of other mental disorders, including fear, anxiety, and avoidance of situation associated with panic-like symptoms like or other situation like agoraphobia and or OCD. The second type of anxiety disorder that we're going to study today is social phobia. Social phobia involves marked and persistent fear of social situation or even social performance in which embarrassment may occur. Social phobia is also known as social anxiety disorder, so I'm going to interchange this name. This is fear of public scrutiny or even public evaluation by others. There are one is have this persistent fear of being judged. Social anxiety can also be seen as excessive fear of social situation or even social performances in which embarrassment is the main component. They fear not being good enough. They fear being judged. Fear may be associated with most social situations related to public performance or even social interaction, such as participating in small groups, meeting strangers, or even playing sports. People with a social phobia may go into great lengths into avoiding being in a social situation. They fear being negatively evaluated by other people. People with anxiety disorder have capacity to build relationship. They are interested in social relationship as long as that relationship is with familiar with people. People with a social phobia are likely to have grown up with a emotional cold parent, so this thing of building relationship is new to them. They always have this thing of, if I go up the stage, I'm going to look stupid. People are going to think I'm weird. People are going to judge me. For one to be diagnosed with social phobia, they must meet these requirements. Criteria one, they must have marked fear about one or more situations in which the individual is exposed to public scrutiny by others. Criteria B, the individual fears that he will act in a way or shows anxiety symptoms that will lead to them being negatively evaluated. Criteria C, the social situation provoke anxiety or fear. Criteria D, the social situation are avoided or even endured with intense fear or anxiety. Criteria E, the fear or anxiety is blown out of proportion to the actual threat. Criteria F, the fear, anxiety, or avoidance is persistent and typically lasting for 6 months or more. Criteria F, the fear or anxiety or even the persistent anxiety causes clinical significant distress and impairment in situation, occupational, or even more important areas of functioning. Criteria H, the fear and anxiety or avoidance is not attributed to the physiological effect of substance or other medical condition. Criteria I, the fear, anxiety, and avoidance is not better explained by symptoms of other mental disorder. Criteria J, if another medical condition is present, the fear, anxiety is clearly unrelated or excessive. Thirdly, let's look at the third type of anxiety disorder, which is the panic disorder. Panic disorder is characterized by the occurrence of panic attack that seems to occur without warning or even occur unexpectedly. Panic attacks are intense period of fear or discomfort that seems so irrational. Panic disorder is a medical condition that may be diagnosed when a person experiences recurrent and unexpected attacks of panic or even attacks of anxiety, followed by persistent concern about having additional attacks and about losing control. The attacks reach a peak within 10 minutes and the attack become less intense within 20 to 30 minutes. They might occur in situations that are less expected or even during relaxation moment. Panic attacks may be accompanied by agoraphobia when someone avoids or engages with a marked distress of a specific situation. They may feel like they are about to have a heart attack. They may feel like they are actually suffocating when they are not really suffocating. The diagnostic criteria of panic disorder. For one to be diagnosed with panic disorder, they must meet this following requirements. Criteria one, they must have recurrent unexpected panic attack, which includes sweating, trembling, shaking, chest pains, feeling dizzy, being unstable, feeling heat sensation. Criteria B, the following attacks must be following for 1 month or more than that. They must have persistent or even worry about additional attacks, or even have a change in behavior related to the attack. Criteria C, the disturbance is not attributed to the physiological effect of a substance. Criteria D, the disturbance is not better explained by another mental disorder. Now look at agoraphobia. Agoraphobia may be referred as fear and avoidance of situations in which an individual feels like they are unsafe, or feels like they will not be able to escape if something happens. An individual with agoraphobia tends to avoid most common situations, or have common fears or avoidance of situations which they feel like they are unsafe. It may include them avoiding the street, avoiding shopping centers, avoiding cinemas, or even avoiding any other crowded places. People with this disorder tend to be anxious about being in places or situations in which they assume or escaping will be physically difficult, or it will be psychologically embarrassing, or moreover, in which they feel like immediate help will be unavailable if something bad happens. These individuals also get scared of their bodily sensation. As a result, they avoid physical activities. Let's now look at the diagnostic criteria of agoraphobia. For a person to be diagnosed with agoraphobia, they must meet these requirements. Criteria A, they must have marked fear or anxiety about two or more of the following 5 situations, which include using public transport, being in open spaces, being in enclosed spaces, being standing in a line, or being in a crowd, or even being outside of the home alone. Criteria B, the individual's fears or avoid these situations because they thought escape might be difficult or help might not be available. Criteria C, the agoraphobic situation almost always provoked fear or anxiety. Criteria D, the agoraphobic situation are actively avoided in and require the presence of a companion. Criteria E, the fear or anxiety is blown out of proportion. Criteria F, the fear or avoidance must be typically lasting for more than 6 months. Criteria G, the fear, anxiety, or avoidance causes clinical significant distresses. Criteria H, if another medical condition is present, the fear or anxiety is clearly excessive. Criteria H, the fear, anxiety is not better explained by the symptom of another medical condition. That is how a person is diagnosed with agoraphobia. They must meet these requirements. In terms of general anxiety disorder, which particularly known as GED, it involves persistent worry or anxiety about a number of things, and the worry is often blown out of proportion. It includes overthinking plans and solutions to all possible case scenarios, and perceiving situations and events as threatening, even in reality when they are not. It includes indecisiveness and fear of making wrong decisions, inability to let go, inability to set aside or let go of a worry, or inability to relax, always feeling restless and always feeling being on the edge. It includes difficulty concentrating because you are fear or I might take a wrong decision. Diagnostic criteria of GED, which is how a person is diagnosed with a general anxiety disorder, is in the following ways. Criteria A, they must have excessive worry and even excessive anxiety. Criteria B, they must find it difficult to control the worry. Criteria C, the anxiety and worry must be associated with one of the following symptoms, which includes restlessness, being easily fatigued, being irritable, having muscle tension, and even sleep disorders. They must have 3 of the following symptoms. That is how a person is diagnosed with generalized anxiety disorder. The last type of anxiety disorder that we're going to look at is OCD, which is obsessive compulsive disorder. OCD involves recurrent obsession or compulsion that are severe enough to be time consuming and also cause stomach distress and significant impairment. The obsession are so invited and intrusive thought or edges or even images that surface in the mind over and over again, such as being concerned about contamination, preventing one from even touching doors, touching door handles, or even doubting yourself, thinking, did I lock the door? No, I didn't. Going back to check if you locked the door, when in reality you did lock the door. The compulsions are behaviors or rituals that a person follows when they try to reduce or suppress their obsessive thoughts, e.g., washing hands more often. They think things like, I'm going to get sick if I don't wash my hands, and I'm going to infect the whole family. The diagnostic criteria of OCD according to the DSM-5 is: Criteria A stipulates that either obsession or compulsion must be present, although usually both present for the purpose of making a diagnosis. Criteria B, symptoms are time consuming and cause significant distresses or impairment in functioning. Criteria C, that the symptoms are not attributed to a physiological effect of substances. And criteria D, they must cause disturbance which is not explained by a mental disorder. This is how a person is diagnosed with OCD. In wrapping up our anxiety disorder lecture, we are going to look at treatment. In terms of treatment, we are going to look at cognitive behavior therapy, which is CBD. This is therapy that intends on helping people change a destructive pattern in their lives and also disturbing pattern of thoughts that leads to negative influence on emotion. This is how a person can be treated in terms of anxiety disorder. We are going to discuss cognitive behavior therapy in more detail in a separate video because it contains a lot of information. And that's it, guys. That's it for our first YouTube lecture. Please don't forget to comment down below which topic would you like us to address, which topics do you like us to lecture on. Please don't. We have reached the end of our lecture, guys. Thank you for watching the video. Please don't forget to share this video with those that might get help from it. Thank you. Love you.